On ahead of the phase 2 vaccination drive on Monday, central government has finalized the cost of COVID vaccine in private hospitals. The cost of each vaccine dose has been fixed at 250 rupees, which means private hospitals cannot charge more than 500 rupees for 2 shots of COVID vaccine. This includes the administration charges of the hospitals as well. So this is an important development that's coming in ahead of the vaccination drive that kicks off tomorrow. The government has also put out a list of which diseases fall under comorbidities. This is for people above the age of 45 years who will be eligible for the vaccine. Only those who are between the age of 45 and 59 years and have the following comorbidities will be given the vaccine. These are immunodeficiencies, HIV, heart disorders, hypertension, diabetes, kidney liver transplant, persons with disabilities, cancer, immune medication, HIV infection, bone marrow failure. And Times Network Shireen had more information about the vaccination drive that kicks off tomorrow and the important developments that unfolded right ahead.
Tomorrow is going to be the start of the biggest vaccination drive that the world will see, because this time in the phase 2 of the vaccination drive, it is expected to the people of India, 27 crore of them is expected to get vaccinated. So this is something that the world will see for the first time. At the same time, tomorrow is going to begin the registration process. No one is going to get vaccinated tomorrow. 1st of March is when the registration process will start. Now, when we talk about registration process, there are 3 ways one person can register themselves. By one person, I mean if you fall under the categories. One is if you are above the age of 60. Second, if you fall under the age of 45 to 59 years age and have some sort of a comorbidity that is listed. There are 20 comorbidities that are listed by Health Ministry, and in case you're suffering from any of that, you will get vaccinated in a few days from now. But tomorrow is when the registration process will begin. There are 3 ways in which one can register themselves. One is that they can download CoWIN app and Arogya Setu app. That will be made public to everyone tomorrow, because remember, Health Ministry has made it very clear that they are coming up with the CoWIN app version 2.0. Now, Saturday and Sunday, that is yesterday and today, the vaccination for healthcare workers and frontline workers have been stopped so that the app could be developed in a way so that it can be easily accessed to people who falls under these 2 categories. Now, tomorrow, other than that, there is on-site and walk-in registration as well. In case someone is not tech savvy and they want to go to the vaccination site and get themselves registered, that can also be done. But of course, they have to carry the required documents. All of them have to, in fact, carry the self-identification identification proof. That is about 12 of the identification proof has in fact been listed. One is Aadhaar card, passport, driving license, voter ID card. These are something when you reach the vaccination center. Now, when it comes to the people who they have to list down from in the 20 list that is given by the Health Ministry. They have to self-attest that. There is a certificate that will be given to them that has to be self-attested and has to be signed by a medical practitioner. That will they have to, of course, provide that at the vaccination center. There are 2 kind of vaccination centers. One is the government vaccination center that will be available nearby to the beneficiary. A time slot will be given. In the government vaccination center, they don't have to pay anything. It is absolutely free. But in case a beneficiary wants to go to a private vaccination center nearby, they have to pay around 250 rupees per dose. Remember, there are going to be 2 doses that will be given to each of the beneficiaries with a time gap of 28 days, I beg your pardon. And each of these doses are going to cost them about 250 rupees. That is in total 500 rupees in case a beneficiary wants to go to a private vaccination center. So the vaccination center list of both the private and the government has been listed in the Health Ministry web portal as well. They are going to be nearby a person's beneficiary's place, and they have to get themselves registered and get themselves vaccinated according to the time slot that will be given to them.